Good morning, everybody. My name is Tony Incroci. I'm the Safety and Education Manager for ABC of Western Washington. And welcome to our webinar today, where we'll be discussing the Governor Inslee's vaccination mandate and how it applies to our contractors. Joining us today from LNI, we have Nicholas Reul, who is with DOSH, as well as John Stebbins from DOSH. And we also have Caitlyn Jekel. I hope I pronounced your last name correctly. And she is with the governor's office. So hopefully they'll be able to provide us some insights on how the vaccine mandate is going to work when it comes to some of the construction and maintenance contracts that you may have with the state of Washington. And with that, I will go ahead and turn it over to Dr. Nicholas.
Thanks so much, Tony. Thank you very much. So we're really pleased to be able to be with all of you this morning and speak about this. And I thought what I would do in reviewing with Tony, we know you have a number of questions, but just as to ground our conversation, I'm going to put into chat here the link to the governor's proclamation for the vaccine mandate that we understand you have questions about. And so I'll just do that right now. And so just high level, the order has basically on page 4, starts on the bottom of page 4, 6 items that are required with an effective date of October 18th. That's the one to circle on my calendar. So per the order, any worker who is engaged in work for a state agency after October 18th will have to be fully vaccinated against COVID-19. And then also the state agencies need to make sure that any worker engaged for work for the state agency will also need to be fully vaccinated against COVID-19 and provide proof as described in the order. Similarly, it's the same setup for educational settings, again, with October 18th, that operators and employees, basically, those employees need to be fully vaccinated as well on the 18th. And then parts E and F, moving on to page 5 of the proclamation, talk about the requirement that healthcare providers need to be fully vaccinated against COVID-19, and then also that any operators of healthcare settings need to make sure that any healthcare providers engaged in work for the operator as an employee or a contractor or volunteer also needs to be fully vaccinated. So we understand that in particular for this group, the link between these requirements to be fully vaccinated and then contract work is of particular interest. And I'm not sure if he's here yet, but we're hoping that we've got somebody coming from the Department of Enterprise Services as well to help with that. And Caitlyn, if I'm not mistaken, I think Bill's only able to join us for maybe the first 30 minutes roughly of our conversation. So if that's the case, we may just want to make sure to focus some of those questions early on, if I've got that right. And I think actually Bill was just able to join us, Tony. Could we just provide an opportunity to introduce him as well to the group?
Yeah.
So I'm Bill Frary, and I'm an Assistant Director for Facility Professional Services, and we do public works contracting for state facilities.
Great. And so Tony, so the way this is working, we know that many folks who are here on the call today do work for the state agencies through contracting, and maybe that would be a good place for us to start in terms of some of the inquiries that you had received ahead of time. We could, we've got the right folks here to speak about some of that. And if you have any questions you'd want to tee up for us, how does that sound?
That sounds great. I'm trying to bring up my list of questions here. If anybody has a question, you can feel free to ask your specific questions in the chat. And I'll make sure to relay them to our panel here, or you can unmute yourself and feel free to ask the question. Here. So I guess I'll start off with one of the more common questions that we've been fielding. You know, a lot of confusion seems to be with some of these contracts that some of our members are that they have. They're wondering if how it applies when they're doing an improvement project at an existing medical facility, where they may be doing some improvement work to a specific floor, but even though they're in an active hospital or medical environment, there are no patients on the floor that they're working in or the wing that they're working on. You know, so they kind of they've got that separation, but for them to be on that job, does the vaccine mandate still apply to them?
Thanks, Tony. So I'll point folks' attention to the link that I dropped into the chat, which has our FAQ. It's being regularly updated based on the questions that we're hearing coming in. And so I think you'll find this continues to be fine-tuned. But we certainly, there's links at the top of that page that jump down to contractor-specific questions and other things. And we do jump in here to how this applies in a healthcare setting, a state agency setting, and an educational setting. Because as you know, there's the pieces around something being a healthcare setting, which is used for patient care, and an educational setting where students or people receiving services are present. So I think you'll find quite a bit of what you're looking for there. Really, the cleanest piece around a healthcare setting is if you're talking about an improvement, such as a new wing, completely distinct from an operating healthcare facility where there's a barrier from the construction site that's occurring and where patient care is occurring. That's going to be your cleanest example of where it hasn't become a healthcare setting yet. I'm constructing a new wing. It does not have patients on it. And certainly when you start to get into places where I know some of you are doing improvements where you're going to be walking through the hospital to get to potentially a job site that is cordoned off from where patient care is occurring, but you're still going to be using the bathroom, you're going to be walking in the front door. That's where we're going to say you're interacting with a healthcare setting and the mandate applies. So there's a whole what's included and what's not included piece in that section that I think should get you everything you need as far as where we differentiate what is a healthcare setting.
Let's see here. Now, what are you know, along the lines of, so, you know, in terms of remaining in compliance and getting employees to get vaccinated and share their information, is there a process that has been determined to be a better avenue for auditing who is and isn't vaccinated? Because I know a lot of the responsibility falls onto the employer to assure that their employees are vaccinated, but you know, from the state trying to enforce that, you know, a lot of people are still leery about sharing that. They still have this understanding that that's still kind of a gray area in terms of sharing that information. So how do they prove to the state that, yes, all my employees working this project are vaccinated?
Bill, you're on mute.
I'll jump into the approach that DES is taking to that. Is we've supplied all of our contractors, for the most part, with a declaration form. And the declaration is that the prime contractor or prime consultant is responsible for their own employees and for their subconsultants and subcontractors. They're responsible to view the vaccine verification records for their employees, evaluate exceptions to the vaccine mandate, and come up with reasonable accommodations. The prime contractors are it's perfectly acceptable for a prime contractor to accept declarations from their subs and keep those in their vaccine verification plan, if you will. When new subcontractors come on board, we'd like that that vaccine verification plan to be updated and a new declaration submitted to DES. And at this point, you know, we've elected to allow contractors to maintain that employer relationship. We don't know, of course, contractors have more than one job going on, so a reasonable accommodation may just be that they're not working on a state facility at this point in time. In the event that we see something that may be amiss, we reserve the right to investigate further and sit down with our contractors to review that vaccine verification plan or ask to see vaccine verification records or reasonable accommodation documentation that that a prime or a sub has pulled together for their employees. But at this initial stage, we're asking for those declarations to be submitted and plans to be developed on the part of the private contractors. Does that make sense?
I would add a couple things here. Again, to the link that I put in the chat, there are template forms that at least give you a sample here of how you can do this, both a form to be using with your employees on exemption requests, and then also in our contract management tool, there is a form declaration tool as well. So I think you can get some good samples there on those links as well.
Appreciate that. Let's see here. So another question that we've been getting asked a lot is, are there going to be any allowances for exemptions to the vaccine for people to still continue to work on those jobs? Or does the employer have to find a reasonable accommodation and find other places to employ them, which I think some of our contractors are worried about, because they're still facing the challenges of trying to get their entire workforce vaccinated. But I've been in contact with a couple of them where one person on one of their crews just does not want to reveal his vaccination status. And so they're like, well, then you're just not going to be able to go to work with your crew, and they've found other things for him to do. But from the state's point of view, is there going to be any sort of medical allowance clearance, or is this just 100% you're either vaccinated or not?
So again, for DES projects, you know, that's the responsibility of the contractors to develop what those reasonable accommodations are. The Department of Health and the Department of L&I have issued guidance on COVID safety plans, and most contractors working on state or federal projects have those COVID safety plans that are in effect. Everything from supervision to training, to wash stations, to PPE, to those sorts of activities. I do know that individual agencies are implementing higher standards, and the contractors, you know, if and when we're investigating, we will want those contractors to be in compliance with those higher standards. For DES, we're struggling with the same thing, right? So, you know, I'm trying to get my staff of 85 people all vaccinated, verified, and there's a number of there's a number of my employees who have asked for both medical and religious exemptions. Some have been denied and some have been approved. And I've met with my HR division, and within our guidance, I've got a number of folks that have received exemptions from the mandate based on religious grounds, and they cannot be accommodated. And the responsibilities for those individual positions require them to be on site with contractors, with clients, with other DES individuals, and we cannot accommodate that. So at the end of the day, again, I don't want to be the one telling private organizations what the responsibility is between the contractor and their employee. But at the end of the day, the answer to your question is we want vaccinated people working on our projects.
Right. I think that was a good answer.
And Tony, I think it might be helpful to hear a little bit from the workplace safety element to that question as well, if you're all right with Ellen and I chiming in on this too.
Yeah.
Yeah. So, generally, what we have is we have a number of different levels of protection or mitigation strategies for protecting everybody from COVID on the work site. And what we're doing is we're elevating one of those, which is vaccination, and bringing things to a little higher standard. So what happens is if somebody is not vaccinated, then there's a need for increasing other protections on the work site, creating and maintaining that healthy and safe work site for everybody there, and particularly if you're in certain settings where there's a vulnerable population, there's going to be a interest of the project owner to establish a safe place for those folks. So in hospitals or in correctional institutes, there may be a much higher standard for what is necessary for accommodation. If you're out on a street job and you're away from other people, then it's just an inter employee issue. And so you may have to do more distancing, you may have to do more masking, you may have to have some of those things addressed, but you wouldn't necessarily, and it also differs some on, if you've got a workforce that is almost entirely vaccinated and you have just one or two people you're accommodating, that's a lot different than if you have 30 or 40 people who are all working in the same work unit and aren't vaccinated, then we're expecting a much higher level of protection across that. That makes sense? Do you have anything?
Yeah, thanks, Sean. I think the last thing I would just add on this is that there's going to be some back and forth and communication necessary between the project owner and the plan. So it's on the private company to walk through the accommodation framework, work out with their employees. The contract holder has the right to communicate with you about what your plan is. I've seen at least one school district say a reasonable accommodation for us isn't somebody working on site that's not vaccinated. Another one may have a different risk threshold depending on the nature of the job, or when are the folks working, how cordoned off are they from other elements of the work. So there's a bit of a review process that's going to take place as far as the nature of the job and the nature of the contract.
Okay. Oh, that makes total sense. So I just had a question come through in the chat. So we are a prime contractor on a public works project of a housing complex owned by the housing authority. Are the job site workers required to also be vaccinated? So I guess the question being here is, because it is a project owned by the state, and it's a public works project, would those employees being on that job site all need to be vaccinated as well?
So I can jump in, and Bill, do you want to remark on this one?
Yeah, I don't know the answer to that. you know, the proclamation kind of walks through, you know, what applies, and where the housing authority lies within that. I don't have specific knowledge to, but the guidance as I interpret it is that we're talking about a worker on a state site, educational setting or healthcare setting. So I haven't looked at it specifically from that angle, so I don't know.
And I also don't know a ton about the exact example that you're saying. However, I will flag that there are a number of ways in which the state is funding a project, and that's the project site is not on state-owned property or on site at a cabinet agency that's covered by the proclamation, or a medical facility or an educational setting. So just because a project is a subrecipient of state dollars or has a contractual financial management relationship with the state doesn't mean it is on site at a state agency. So it's really about where the work is occurring more so than where the money is originating, if that makes sense.
No, that makes sense. And kind of tailing in, I mean, when we've talked to members about this question, I've been advising them to go back to the agency that they have the contract with for clarification on that. Because you know, and unfortunately, I do know there's probably a lot of people scratching their heads trying to figure it all out as well, even at the state level. So then another question that's been coming up is with the vaccination mandate, when reasonable accommodation can't be made for an employee, and unfortunately that employee is not going to be able to retain their employment status, is there going to be an effect on their ability to collect unemployment benefits because of that? And what is the ramifications of that decision?
Yeah, so the impact on unemployment insurance is, of course, like with any of these questions, going to be on a case-by-case basis. There are a couple of ways in which someone may encounter unemployment insurance as a result of the vaccine mandate, some more cut and dry than others. So if a person simply says, I'm unwilling to do this, it's just not something I want to do, I'm walking from employment, that's going to be more likely to be a circumstance where somebody is not eligible for unemployment insurance because they're just expressing an unwillingness to engage in a mandatory element of the job. However, if somebody meets the threshold of a religious or medical exemption, they've done all of the work that they needed to do to engage with their employer, request an accommodation, they've gone through that accommodation framework, and unfortunately the employer is unable to accommodate them, that's going to veer into the space of a more likely outcome that someone would be eligible for unemployment insurance. So that's sort of my nuanced way of saying it depends, but it really does. There's going to be a degree of fact finding here from the department. We do encourage people to file unemployment insurance to make sure their individual case is being reviewed, but that's going to be the sort of metric through which that adjudication process is going to be looked at.
Good to know. Excuse me. So another question that's coming up is that who is going to be in charge of basic enforcement of the mandate? I mean, is that going to be coming directly through L&I and through their typical compliance audits, or is that something that's going to be handled between the agency and the contractor?
I'm looking at our team to see who wants to jump in. I feel like I'm doing a lot of talking. Anyone want to jump in here?
Maybe Bill should start with this, and then we can follow up on how we would look at the situations.
You bet. And so my team, and the long pause is basically, I don't know 100% yet. So there's some indecision in my response, but my team's going to monitor the project just like they do with every other contract requirement. If something doesn't look right, they'll begin an investigation and will likely contact L&I for support in that in that investigation. Ultimately, our contracts, we enforce the terms of our contracts, but because this is a health and safety violation, we want to do that in partnership with L&I.
Yeah, and it's still something that we're looking at, as well as to just how we're going to approach some of these things. But generally our focus isn't, it's going to be, looking at whether they're in broad scope, the contractor is in line with the mandate. If there's clearly issues with how they're approaching it, then we can approach that, or we might refer it back to the contracting agency. And then our greater focus is going to be on whether we're maintaining a healthy and safe workplace. And so if there's exemptions being provided and accommodations being made, are those sufficient to maintain that level of protection across the board, and for the contractors, employees, and for others who may be on the work site. So it's not, I don't see us getting into the weeds on some of the contract issues or things like that. That would go back to the contracting agency. But once those things are worked through, it's a matter of, is it a safe workplace?
Yeah, and I would just add to that oh, I'm sorry, Caitlyn, go ahead. Oh, okay, yes. So I was just gonna add that I think we all share the same goal, of course, of ultimately bringing the pandemic to an end. And we've got a lot of experience collectively now in terms of the layered interventions that we know work to help keep people safe and healthy in our workplaces. And so I would just mention that while, as we're talking about today, the state as a whole is really, putting into place policies that really leverage the fantastic benefits that come from vaccination. And, the vaccines are just remarkable. All the other interventions designed to keep a safe and healthy workplace there are just they remain important. And the experience that all of you have with working through those, just continue to think about that as you make these decisions for your workplaces. So I think just keeping an eye on the full spectrum of interventions designed to keep people from getting COVID-19 remain important, even at the same time as the vaccine is something that is by policy now of paramount importance because of how effective the vaccines are. So I just wanted to make sure we don't forget, of course, about the balance of interventions that also are important to continue to carry out.
And the last thing I'll add is with anything with enforcement throughout the COVID-19 pandemic on the state side, we've assembled teams where if a complaint comes in, we're able to triage, take a look at it. Everything starts with a consultative, reach out to someone to say, hey, do you know this is the requirement? And depending on what type of a project it is and who's the contract holder, that might look differently if you're at a school or a state agency. But we expect and assume we will have various complaints or concerns coming in from different channels as we have throughout the pandemic. And so, we take those in and make sure that the right entity is reaching out to a contractor where there is maybe a question about their level of compliance, so that we can offer that support from the right avenue as it comes in.
So kind of following up on that question, I've been asked this question twice now since in the past month. What are going to be the consequences of a contractor who just does not want to comply? I mean, are they at risk of losing their contract? Is there going to be, obviously, because I understand as it being a safety and health issue, obviously L&I being involved, I'm sure there would be citations from that side of things, but more on the contractual side, is there language in those contracts that because they're failing to follow this new mandate or guidance, are they in jeopardy of losing those contracts?
The short answer is yes. So, and I'll give you a little bit of a longer answer. So every contract is different, right? So my division has contracts for design, for bid build, for design build, GCCM, job order contracting, energy. All of those contracts are a little bit different. DOT's contracts are different. The school district's contracts are different. So, so I would offer that you that you look at the breach of contract language that's in each one of those contracts. And the way that I'm viewing it is that failure to comply with the mandate is a breach of contract under the health and safety mandate to follow all state laws. If a contractor who's working for DES does not comply with the mandate by October 11th, they will receive a stop work order from my office, and they will have to come into compliance prior to going back to work, meaning that they'll have to submit the declaration and receive a notice to proceed back from my office. If a contractor refuses to sign a declaration that he's in compliance with the mandate, we will be terminating for cause.
Carry definitely some serious consequences.
And believe me, I completely understand the consequences from the private sector regarding this, and I don't do this with any sort of malice, but I'm responsible to implement the mandate, and I'm responsible to follow the terms and conditions of our contract, and that line of events that I laid out is something that folks need to be clear about.
Okay. Yeah, I think where one person who asked me that question, they were more concerned because they know their workforce is, one of their crews is 100% vaccinated on a job that they're working. But the GC that they're working for is kind of been questionable on their whole approach in the past month on how they're going to deal with this. So they're more worried about their inability to work because of being a subcontractor to somebody who's kind of wishy-washy at this point.
You bet. And one thing that I want to make clear after I laid out my hard line is that DES has always partnered with our contractors. We feel that is the best way to have a cooperative relationship, end up with the best product, and work in the best interest of the state and the private contracting community. If a contractor come the 18th just hasn't gotten it done yet, we're going to be working with them to help bring them into compliance so that they can continue, once that declaration comes in, so that they can continue to work on the project. So, again, we will work with you.
Okay. So from what I'm gathering and kind of, maybe I want to make sure I'm not misinterpreting anything. So really with that October 18th deadline, that depending on the communication that the agency and the contractor have, that can kind of be a somewhat soft target date as long as they're progressing in the right direction. It's not like October 18th. It's if you don't have 100% compliance, you're getting the stop work order.
So let me be clear. If on October 18th, we don't have a declaration stating that you're in compliance, you will receive a stop work notice. You're not going to receive a termination for cause on that date. Okay. And in the intervening weeks, we'll be working with you to get you into compliance. But if you cannot or will not submit that declaration, then we will be issuing the termination notice.
Okay, so as long as they're in the works and they have everything on their end done, they're golden. So even if they're say they have employees who may not necessarily be working that job, but if they're waiting for them to become fully vaccinated, then they're still going to be able to continue moving forward.
As long as the people that are on site are vaccinated.
Okay. All right.
So the language of the proclamation says someone is not permitted to work or engage in work. And so I think that's going to be really critical, where you have a few holdouts or you have folks that maybe, initiated the first vaccine, they're intending to do it, but they had a lag time, things of that regard. The declaration is saying, I'm in process, I'm compliant. The people who are on site are either vaccinated or have engaged in a reasonable accommodation process. Doesn't mean you aren't going to have folks you're still continuing to bring along. It's really about the agency and the contract holder having that declaration in hand that says, yep, I'm doing it, I'm following this. That's what we're going to be looking for.
Okay. So there.
Yeah. One more thing on that. I think some people do get temporary medical accommodations, right? So if there was some reason, we're hearing from a lot of folks that got their first vaccine and then became COVID positive. So they're having a lag time to be able to get that second vaccine, things of that regard. I think there's a lot of nuance that maybe people are thinking, not thinking about how the accommodation process can address those.
Okay. And then, so kind of piggybacking on that declaration. So if you're a subcontractor on a job site, you're basically dealing with the GC, that you're not necessarily dealing directly with the agency. So everything that you're going to be doing as a sub is going to be submitted to the GC to be in compliance, who will then submit to the state. So
Yes.
Correct. Okay. So as long as you're having that mechanism of reporting through the proper chain of command.
Yes.
Okay. There was another question. Yeah.
Yeah, just if it's okay, just to briefly mention here, I know that the this particular area of policy is triggered a number of at times difficult conversations in our state's workforces in workplaces, but I do think it's important to just mention that what at its core, we are protecting people from a potentially life-threatening infectious disease. And we have here, among the several different interventions that can assist us with that, the vaccines are demonstrated to be effective and safe and really powerful in helping us accomplish that goal. And so I just, again, just to reemphasize that despite the fact that these are difficult conversations, it really is because of those factors that, that's driving this, and that our goal is, not to lose contractors, but to fulfill our mandate to make sure, and our responsibility, that we have a safe and healthy workplace for employees, in particular here, where the state is funding that work. So that's at the core of the context here, and why this is going forward in this way. And we're not looking to, we want people to be vaccinated. We're not looking to lose contractors. I just thought it's important just to make sure to, keep that in mind as we continue this discussion about the details here of some of the potential consequences if, for whatever reason, we're not able to get there in a given situation.
Appreciate that. So we just had another question come through. So to clarify, if a job site is physically owned by one of the government agencies, such as the housing authority, then the mandate applies. So if I'm reading this question correctly, so that what they're asking is trying to get to, if the property that the contractor is working on is owned by the state, then the vaccine mandate would apply. So
Correct.
In their case, it sounds like the property actually is owned by the state housing authority. So the mandate would apply in that case.
So I'm not going to speak on the Housing Authority one because I'm just not familiar enough to give you a definitive answer. But yes, if it's a state agency owned property, the Capitol campus, DOC site, a DSHS site, those types of things. It's state agency. Yes, it's and the worker's going to be working on site. You're under contract with this. The mandate applies.
All right, and let's see here. So I did have another question that came through the chat. They're wondering, has there been any discussion on how or if the state vaccination mandate will be adjusted to align with what the federal mandate is that should be coming out here soon? Or is there going to be a totally separate mandate for employers?
So we're still waiting to see exactly what the OSHA rule is going to say on that, and how that, whether there's anything that's going to be, not in alignment with the state level mandates. As the OSHA rule comes out, we will look at that, and we will, so Labor and Industries will issue its own rule based on the federal rule, and we'll have an opportunity to make sure that there's no conflict, at least, and align them so that they work together. There's also been some federal mandates that have come out based on federal funding of things, and I think those are all somewhat less stringent than what we already have at the state level.
Okay.
I'll just add to that. Oh, I'm sorry, Tony. Yeah.
I was going to say, I totally understand that that's going to be a moving target until OSHA actually comes out with their emergency temporary standard.
Yeah, and just so the group is aware, there will definitely be opportunities for engagement with us and input, and we will, as things continue to evolve and we see what comes from federal OSHA, we will be doing our usual approach with making sure we have their opportunities for feedback, and so even though we don't have some of the definitive information today, we do expect, like has happened before in the pandemic, that this is an evolving process, and probably more conversations to come in this area.
Okay. All right. And are there any other questions from anybody in the room for our guests? Feel free to unmute yourselves.
Tony, I will flag, I've been dropping things in the chat if anyone's on by phone only, but I did put the link to the state executive cabinet agencies, which are the on-site entities that are covered here, as well as a list of separately elected officials which have issued similar policies, so it would apply to contracts occurring on site at those. I'm sorry we aren't clear on the housing authority question, but the housing, I believe that largely the housing authority question would be state-funded projects on non-executive cabinet agency properties, but that person should definitely reach out to the contract holder. But I think these lists of agencies will help at least guide the landscape of what state agencies are covered here.
No, I appreciate that, and I will be including all these links when we post this recording to our website for other members who weren't able to join us today. All right, and let's see here. Well, I think you guys have pretty much answered all the questions that we had. I really appreciate your time that you gave to us to answer these questions in this type of forum. I felt it was very informative and actually shined a lot of light on some of the inner workings of how this mandate is being applied. So I'll go ahead and I'll ask if there's any other questions from anybody in the room. Well, if there aren't any other questions, I would like to thank our guests for their time and the information that they provided. And thank everybody for joining us. And this session was recorded, so it will get posted probably tomorrow to our website. And it'll be a resource for folks to be able to review at a later date. We will also make sure to include the links that Caitlyn was generous enough to share in the chat. And I will also include, if you guys don't mind, I'll also include your contact information as well in case somebody wants to reach out to you directly.
That sounds good, Tony. And I just, again, we really, really appreciate you and your group's thoughtfulness and, care and attention to the questions that have been arising here, and your help helping all of us to keep our state's workplaces safe and healthy, and continue with our progress to beat the virus and ultimately end the pandemic. So that's just really paramount, and we really appreciate it.
Well, thank you.
Thank you.
Thanks for the opportunity. Have a good day, everyone.
Thank you. Bye, everyone.